After cleaning my hands, I have now set out all the equipment I will need to draw a small amount of blood from my arm and then immediately inject this freshly drawn small amount of blood back into one of my muscles. The equipment I use for drawing my blood consists of a tourniquet, syringe, hypodermic needle, butterfly needle, cotton balls, isopropyl alcohol, and a sharps container. I lay everything out on a towel just in case there is any spillage of blood. Both types of butterfly needles that I use have safety shields on them, and I will demonstrate how they are used. After taking the sheath off and drawing your blood, this safety shield flips up and clicks into place over the needle. This one here, after the sheath is taken off and your blood is drawn, has a safety shield that slides up and covers the needle. I'm now going to demonstrate how I attach the syringe to the butterfly needle. Taking the syringe out of the packaging, and I just give the plunger a little push in. Unscrew the end of the butterfly needle. The cap comes off, and the syringe just screws on to the end of the butterfly needle like that. And does. And the other butterfly needle, the same, screws on. The next step is to locate a vein. We're going to look in the antecubital fossa area, which is a triangular area inside the elbow. So if you draw a triangle, now there's three primary veins in this area. There's the cephalic vein, which runs on the outside of the arm here. There's a median cubital vein, runs in the middle, and the basilic vein that runs on the inside of the arm. The first choice of vein would be to look for one in the middle of the arm, the median cubital vein. It's well anchored. It's usually the largest and the easiest to find. Your second choice would be on the outside of the arm, the cephalic vein. That's fairly well anchored. Your third choice would be the basilic vein on the inside of the arm. This vein tends to roll a bit more, and it's also located above an artery and a large nerve. So you want to kind of tend to stay away from this one and try to go the middle of the arm or the outside of the arm. Now I'm going to demonstrate how to tie a tourniquet. I'm going to be drawing blood from the center of my arm here. So now I want to apply the tourniquet a couple inches above that. So I'm going to apply the tourniquet about here. So I drape the tourniquet over my arm, grab both ends, pull taut, grab the bottom strap with my left hand, and then just grab a closer grip on the top one, and bring it over and tuck a little piece of it underneath. So you have a little tab sticking out here. Both tails you can move out of the way in the area that you're going to be drawing blood. And now you have a quick release when you need it. I now have my tourniquet tied on my arm. I'm going to feel again which vein I want to use and where it is. I have one here, and I also have one here that I use. I'm going to use this one. I swab the area in a circular motion from the inside out, and I also swab off my fingers. You may want to check where the vein is again before you insert the needle. I place the syringe in my hand so that I'm able to pull up on the plunger with my thumb. Take the sheath off the needle, and I'm going to go into the vein. I'm going to pull my skin taut with this, my middle finger here, and I'm going to go in the vein at about a 20-degree angle from the surface of my arm. I'm not going to go in at a 45 or a 90-degree angle. I'm going to go in at about a 20-degree angle from the surface of my arm. The needle, I am holding one side of the wing here. These wings have little bumps on them to indicate that that is the side that the bevel is up. You want the bevel of the needle showing upward. So you pull your skin taut, put a 20-degree angle, and then you're going to give a quick little jab insert into your arm. Now what you'll see when the needle goes into the vein is you're going to see a little flash of blood at the beginning of the tubing here. Once you see that little flash of blood, the very tip of the tubing, then you can pull on the plunger, on the syringe. If I were to use a hypodermic needle, like so, I would have very little control over the needle moving around in my vein as I'm trying to pull out the plunger. The needle moves around quite a bit. I prefer to use the butterfly because I can hold the needle securely in the vein while I pull on the plunger with my free hand. There is no movement of the needle while I'm pulling on the plunger. I find this technique much better than using the hypodermic needle and the syringe. I'm going to put it all together now for you and show you how I draw blood for myself. First of all, I'm going to get my supplies ready. I've washed my hands. I've got everything I need here. I'm going to open the packaging, but I'm not going to take anything out at the moment. And have everything ready. I'm going to tie my tourniquet. I'm now going to find the vein I want to use, make sure I can feel it. I'm going to use this one here. Now I'm going to clean the area with alcohol. I'm going to clean my fingers with the alcohol. While that is drying, I'm going to take out my syringe and attach it to my butterfly needle. The bumps on the wings on this particular butterfly face upward, and that is telling me that the bevel is facing up. I'm going to take the sheath off. I'm going to hold the syringe in my hand so I can move the plunger with my thumb. I'm going to pull the skin taut with my middle finger. I'm going to insert the needle in my vein at about a 20-degree angle. And I'm going to insert the needle about a quarter of an inch in. Till I see a flash of blood. I'm going to show you the flash of blood. I'm just going to flatten the butterfly needle, the wings here. Lift that up. And you can see the blood flowing through the tube there. Now I'm going to pull on the plunger, and blood's going to go through like that. I'm going to draw up what I use, 1 mil. In the syringe. Now there's 1 mil. What I do now is I just flatten the needle there. Quick release on the tourniquet. You want to release your tourniquet before you take the needle out, or you'll have blood all over the place. Grab a cotton ball, place it over top the needle, and with these 2 fingers I grab the wings, and with my thumb I press down on the cotton swab as I take the needle out. I immediately bend my arm to hold the cotton ball in place. I immediately cover the needle. You can hear it click. Draw the rest of the blood into the syringe. And then, to get all the air out of the syringe, I will push up on the plunger. Get some blood coming out the tip of the needle there, so I just hold cotton swab. So push up on the blood on the plunger, push the plunger up to get rid of all the air. There. Get your hypodermic needle ready. Unscrew the end of the butterfly tubing from the syringe. Attach the syringe to the hypodermic needle. Now, you want to make sure all the bubbles are out. I'm going to flick it, make sure there's no bubbles around the bottom. and no bubbles around the top. And flick them. Then you want to prime the needle. Make sure there's blood coming out of the tip into the cap. Just to make sure you've got all the air out. Now you're ready to immediately inject this blood into your muscle while it's still warm. I place the syringe down on the towel. I take my butterfly needle. I put it into the sharps container, right into the sharps container. And in my garbage. And now I'll inject the blood. First of all, I'm going to swab my thigh with isopropyl alcohol in the area that I'm going to inject my blood. When I inject my blood, I keep my thigh muscle relaxed. I do not engage the muscle. I keep it relaxed. I'm going to give my thigh a quick little jab with the needle. Like so. And I'm now going to inject the blood into my thigh with small pumping actions. I want to inject the blood fairly quickly because I do not want any clots to form. If clots form, you may find it difficult to inject the blood. If you happen to inject the needle into a previously used spot and you find it difficult to inject the blood, remove it from that spot and place it in another spot. Now that I'm done, I grab a cotton ball, remove the needle, and press. I have now finished injecting the blood into my thigh, and I want to discard of the needle. You can either place it in here, the whole needle and syringe, until you're ready to take the needle off, and then when you're ready to take the needle off, use the slot beside here to capture the hub of the needle, like so, and then twist it off so that the needle drops into the container. I will rinse this syringe out in the sink with water and then discard the syringe in the garbage. And that's it. That's all there is to it.